Welcome to my channel, guys. Today we are going to discuss a very important topic, that is Rass, Richmond Agitation-Sedation Scale. Okay, so this we are using for ICU patients. Let's begin. Rass, Richmond Agitation-Sedation Scale, it's a 10-point scale and in which the score range goes from 0 to 10, and baseline level is 0, which denotes an alert or calm patient, and if the score from +1 to +4, that denotes patient's level of anxiety or agitation, and score -1 to -5 denotes level of sedation. So basically three things we are checking in this scale, that is patient's level of agitation, patient's level of sedation, and delirium in the ICU patients, and mostly those who are mechanically ventilated patients. So 10 points are there. When it is in plus score, that denotes agitation. When minus score, that denotes sedation, and if the baseline is 0. Okay. Next we are going to see the uses of Rass, Richmond Agitation-Sedation Scale. So three uses are there. One is sedation monitoring, that mostly used in setting of mechanically ventilated patients in the ICU to avoid over and under sedation. Second is assessment, that means to assess the level of consciousness and agitated behavior in ICU patients. And third one is delirium screening. So obtaining a Rass score, Rass means Richmond Agitation-Sedation Score, is the first step in administering the confusion assessment method for ICU, that is CAM ICU, confusion assessment method, which is a tool used to detect delirium in the ICU patients. So what's the use of Rass scale? First one is sedation monitoring. You have to remember that why we are checking the sedation, to avoid over and under sedation, and assessment to check the consciousness and agitated behavior of the patient and to detect the delirium in early step. Here you can see the scale. 0 means alert and calm, +1 restless, +2 agitated, +3 very agitated, and +4 combative. Combative means violent or danger to staff. And -1 is drowsy, -2 light sedation, -3 moderate sedation, -4 deep sedation, and -5 is unarousable. That means patient is unconscious. Okay, so this is the scale. In this only, based on this we are writing the scores. So here you can see 0 means patient is normal, alert and calm, and this +1, +2, +3, +4, which we, by observing the patient, we can check this. Now how to check and how to write the score? So for that procedure is there. Observe the patient. Patient is alert, restless or agitated, we can give score 0 to 4, and if patient is not alert, we have to state the patient's name to say open the eyes and look at the speaker. Patient awakens with sustained eye opening and contact, that means if patient listens to you, opens eyes and maintains eye contact, -1. If patient opens eyes but cannot maintain the eye contact, -2. Patient has any movement in response to eyes but no eye contact, means patient is opening the eyes but he is not at all looking at you, so we will give, for that we will give -3. So -1 if he maintains eye contact, -2 he maintains for less than 10 seconds, and -3 he opens the eyes but he is not maintaining the eye contact. Okay, that's we are giving the score -1, -2 and -3, and the 0 to 4 we are giving just observing the patient's level of behavior. And third step is, if patient does not respond to voice, we have to physically stimulate patient by shaking shoulder or rubbing sternum. Patient has any movement to physical stimulation, -4. Patient has no response to any stimulation, that means -5. So when he is not responding to voice, to movement, that means he is under deep sedation, -5. And if he responds to stimulus, that means -4. So that's all about Richmond Agitation-Sedation Scale. So I hope you understood. Please subscribe the channel. Thank you.